For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Hello everyone, and thank you for being here today. We are here to address outbreaks in long-term care facilities and homeless housing situations, and right with that we will go directly to Dr. George Hahn. Thank you.
Good afternoon. I'm Dr. George Hahn, Deputy Health Officer for the Santa Clara County Public Health Department. Today we're here to speak about the rise in COVID-19 cases in congregate settings. And we have been seeing outbreaks increase over the last few weeks. These congregate settings include everything from long-term care facilities and skilled nursing facilities to homeless shelters and detention facilities and custody settings. We have seen an increase recently in all of these settings, and this coincides, of course, with the extreme rise in cases that we have been seeing since the beginning of November. What happens is, as cases rise in the community, that also means that there are more cases that get introduced into these congregate settings. The fact is, people who reside and work at congregate settings are members of our community. And so what that means is when the cases increase in our community, that increases the chances that there will be more cases introduced into the congregate setting. And the problem with congregate settings, as you know, is that there's a lot of people in there, it's difficult to do the kind of social distancing that we would want in a regular situation. And so the virus has a chance to spread more easily in congregate settings. Obviously, the public health department, like public health departments all across the country, have been working very hard in partnership with all of these congregate settings to do everything we can to reduce the chances of spread within these facilities. However, the most important thing that we can do to prevent outbreaks in congregate settings is to reduce the number of cases in the community, as I've mentioned. We are now at the point of the pandemic, as you've been hearing over the last couple of weeks, where we have the most cases we've ever had during the entire pandemic. It is more dangerous right now in our community than at any other point in the pandemic. And I think this is a message that everyone needs to really take to heart. That means each of us has a part to play in helping our neighbors, helping our families and loved ones, each other, by staying home, wearing a mask, and not gathering with other people when you're indoors. I think it's important for everyone to understand that all of these things that we are doing, all these prevention measures that we're doing, are just one layer of protection, and no single layer is completely protective. Wearing a mask protects the wearer and it protects other people, but it's not 100%. And so the same thing goes with all these other measures. We have to use them in combination to get the most protection. So we're here to basically, ask the community to do everything they can to reduce the risk, reduce the spread of COVID-19. That goes, by wearing your mask all the time, not gathering with other people you don't live with inside, and keeping your distance. And we ask this because, not only is it to protect yourself, your families, your loved ones, but it's to protect the most vulnerable who are living in our community. I'll be happy to take questions.
We'll start with Mercury News.
Yes, so we have seen a large uptick, as you mentioned, in nursing homes. One in particular on the state website says there's 71 patients that have tested positive. Can you speak to that and what the county is doing to address the rise in cases in nursing homes specifically?
So the question is about the rise in cases in nursing homes, and the county has been, from the beginning of the pandemic, very heavily involved with all of our partners and nursing homes in particular. We have since March given them a lot of guidance on how to best protect their residents and staff from COVID-19 outbreaks. And more recently, what we provide is we provide testing resources so we can identify everyone who's been infected. We provide technical assistance in terms of helping them identify infection prevention measures that they can implement to prevent the spread. And we've even assisted with staffing if they have had staffing challenges due to the number of staff who've come down with COVID or been exposed.
We're going to KPIX.
Hi, thank you. My question is, what is your reaction to the governor's latest announcement about the stay-at-home order based on ICU capacity, and what does that mean specifically for Santa Clara County?
Unfortunately, I just heard about this recently, so we'll take some time to digest that information and formulate a response.
So what does that mean, though, in terms of just where we are with ICU capacity in general as it stands today or the next couple of weeks?
From what I know, from what I understand, ICU capacity is something that we're monitoring very closely, and that it has decreased in recent weeks, and so we know that we need to keep an eye on it, and of course that is one of the main reasons we're asking everyone to take all the safety measures to prevent the spread of COVID.
Yeah, I just wanted to know what outbreaks have occurred at homeless shelters in the county. Can you please describe that?
Yes, we recently had an outbreak at one of our homeless shelters, and this is actually the first major outbreak in a homeless shelter in Santa Clara County since the beginning of the pandemic. This outbreak, once this outbreak was identified, what we did was we put transferred everyone who was positive into a motel so they could isolate safely. And we took the additional step of taking everyone who tested negative but was presumably exposed because they were living in the shelter and put them in hotels as well so that they could quarantine safely. And the reason for that was because, due to the size of the outbreak, we believe that most most residents who were in this shelter were in fact exposed at some point recently, and so we want to take that extra precaution to protect as many people as possible by kind of distancing them by using motel rooms.
How many homeless individuals were infected, and which homeless encampment was that?
So this particular shelter is it's not an encampment; it's a shelter. It's at BRC, and I believe there were around 60 folks who were affected, but that does include 4 staff.
So is 60 the number of people who just tested positive? You said everybody at the shelter was moved into.
Correct. Yeah. So the original. Usually when we start getting positive test results, we'll move the people who are positive into a motel. But because, once we got the initial set of positives, we kept going back to retest to see if there were more people would end up converting to being positive. And when we went back a second and a third time, we found additional people testing positive. And because we kept finding additional people testing positive, that made us realize that the outbreak was perhaps pretty widespread, and therefore we needed to take that extra precautionary step of placing even the people who had tested negative into the motels.
NBC?
Can you make a correlation between what's happening at the congregate places and things like that with your ICU situation? I mean, it's hard to believe that one won't affect the other.
Yeah, I think that the way the outbreaks at congregate settings are related to ICU is just simply by how much COVID is in our community. When the amount of COVID rises in our community, you're going to get more people landing in the ICU, and you're going to get more outbreaks in congregate settings. Both of those things happen because the amount of COVID in the community is so high.
Yeah. So, are there any preventative measures being taken to prevent further outbreaks in homeless shelters or homeless encampments?
Absolutely. So the question is about, are there any preventive measures that are being taken in homeless shelters to prevent outbreaks? And so what we're doing, first of all, is we're working with shelters to ensure that they are implementing all the best practices for prevention of COVID. So these include making sure that all the residents are wearing a mask correctly at all times, making sure that folks aren't eating with each other inside, because as you know, when you eat indoors, that is a really high-risk activity because you have to take your mask off in order to eat. We're ensuring distancing, we're ensuring better ventilation throughout the facility, and we're taking an additional step at this point to increase the amount of testing that we're doing, so that the more frequently you do testing, the earlier you can catch any outbreaks that are beginning. One other thing that we're doing is the county is working to increase the number of motel rooms and hotel rooms that are available, so that when shelter residents test positive, there will be a space for them to isolate safely.
Could you please repeat the name of the shelter where this was 60?
Oh yes, that was at BRC Bocardo Reception Center.
I see. And are there any other shelters where there have been outbreaks, or is there any shelter where there have not been outbreaks?
Yeah, most of the shelters have not had outbreaks, actually. Like I mentioned earlier, this is the first shelter that has had a large outbreak such as this. We're keeping an eye on another shelter at South Hall to make sure that it doesn't turn into an outbreak situation. There is a cluster of cases there right now, and so we're working very hard to try to control that as much as we can.
Do you have the numbers of the total amount of cases that have been determined at homeless shelters in this county? And specifically this cluster at South Hall, do you know how many cases are there? What are you doing?
Yeah, I don't have the total number of cases in homeless shelters since the beginning of the pandemic, but I do have that at South Hall there have been a total of 7 cases in the last few weeks. So, South Hall is, I believe, one of our largest shelters, and so it's still not clear at this stage whether those 7 cases just represent the normal amount you might expect given how much community transmission of COVID there is, or if it represents the beginning of an outbreak. So that's under active investigation.
Well, we've seen sort of a constant presence of COVID in nursing homes since the outbreak even started. Are you seeing more of a spike? Are you seeing more cases now? You're having this press conference, is this something that's more unusual? Are you seeing a much bigger increase now than before?
Yeah, so throughout the pandemic, there have been increases and decreases, fluctuations in the number of outbreaks that are occurring in nursing homes and other long-term care facilities. And right now, we are certainly experiencing an increase in the number of outbreaks in long-term care facilities.
Can you, the nature of how big an increase?
I could just characterize it as a significant increase. Yeah. One more question, or?
Yeah, one more question, Kyle?
I just want to clarify, how many homeless shelters are there in the county? And how many out of those, how many have had outbreaks?
Yeah, I would say that I believe there are dozens, at least a couple of dozen homeless shelters in the county, but this is the only one that's had a major outbreak. Yeah. Well, the one and then the second one that we're keeping an eye on to make sure. Yeah, we're investigating that.
And one final Mercury's question.
Can you confirm that this nursing home is called Westwood Post-Acute or Amberwood Gardens has had 71 positives at that specific nursing home?
Actually, do you know the answer to that? So yeah, it's Amberwood Gardens, I believe, has a total of 151 positives.
Is that the largest, do you know?
Yeah, I think that's the largest.
I'm sorry, Roy, what was that, Amberwood?
Amberwood Gardens, yeah. Okay.
Thank you everyone for attending. We will immediately go into our Spanish language portion of our event right here and turn it over to Dr. Villarino.
Thank you. Roger, so I think it's just to answer questions, is that right? I was told that it was to answer questions. Do you want me to do a statement in Spanish as well? Estamos aquí reunidos el día de hoy para hablar sobre el incremento en el número de casos de COVID-19 en los lugares de albergue en el condado de Santa Clara. Los lugares de albergue, en inglés congregate settings, son todos aquellos donde vive bastante gente reunida bajo un mismo techo. Los de más riesgo desde el principio de la pandemia han sido aquellos como los hogares para ancianos, skilled nursing facilities, pero también hay lugares de albergues como para la gente en situación sin hogar, también en aquellos lugares donde es, por ejemplo, las cárceles, prisiones y demás lugares donde todo el mundo vive bajo un solo techo. El propósito de tener esta conferencia de prensa el día de hoy es sonar la alarma de que el número de casos en ambos tipos de situaciones está incrementándose y que esto no es una sorpresa total debido a que significa que es un número más grande de casos que hay en la comunidad. Como todos sabemos, la gente que trabaja y que llega a estos lugares son miembros de nuestra misma comunidad, y si sube el número de casos en la comunidad, sube el número de casos en este tipo de lugares. Sin embargo, lo más problemático es que en los lugares de congregación la amplificación del número de casos puede ser mucho más rápida, porque hay mucha más gente viviendo con mucha más proximidad, y en ciertas situaciones es muy difícil mantener los protocolos de distanciamiento social, uso de la máscara, etcétera. Entonces, afecta tanto a los residentes como a la gente que trabaja en estos lugares, y además hay más gente vulnerable a la enfermedad grave, como son los ancianos y personas con otras enfermedades. Queremos decirle a la comunidad de Santa Clara que estamos preparándonos tal vez para aún más grave, una situación más grave cuando vengan ahora las fiestas de diciembre, y queremos apelar a la ayuda de toda la gente para que cada quien hagamos nuestra parte. Si disminuimos el número de casos en la comunidad, también protegemos a estas gentes vulnerables y hacemos una marca, una diferencia para tratar de disminuir el número de casos en el condado de Santa Clara y seguir adelante. Finalmente, creo que en las noticias han visto que la vacuna para el COVID-19 está siendo priorizada por los expertos, y el grupo que más tempranamente la va a recibir precisamente incluye las personas que viven en los albergues, skilled nursing homes para ancianos. Entonces, ya estamos empezando a tener buenas noticias, y si ponemos todos de nuestra parte, podemos ayudar a que estas buenas noticias lleguen más pronto a nuestra comunidad.
¿Nos puede hablar un poquito de la situación en los albergues para desamparados, por favor? Tenemos entendido que en un par de ellos ya se han registrado casos, en uno muchos más que no.
Sí, correcto. Habíamos sido relativamente afortunados en el condado de que entre todos los albergues, y hay más de 2 docenas de albergues, hasta la fecha no habíamos tenido un brote significativo de casos de COVID-19. Sin embargo, al momento tenemos uno de un tamaño bastante grande, excede 60 personas, y tenemos otra situación con un grupo menor de personas, 7 personas en otro albergue, el cual todavía está bajo investigación. La diferencia entre que si es un brote o no es si la transmisión ocurrió en el albergue o si ocurrió afuera. De nuevo, es como un espejo. Si hay más casos en la comunidad y la gente va y viene a estos lugares para trabajar o pasar la noche, puede ser que el lugar de infección haya sido fuera de este lugar.
¿Qué están haciendo con los clientes de esos centros de albergue que salieron infectados?
Como siempre, el condado tiene la responsabilidad de atender a estas personas. Desde el inicio de la pandemia tenemos moteles que están contratados por el condado, en el cual si el resultado de la prueba que se hizo para el COVID es positiva, hay unos lugares especiales, moteles especiales donde la gente puede estar. Y en esta situación también la gente que no salió positiva a la prueba de laboratorio, pero como el grado de exposición es tan significativo en estos lugares, sabemos que tienen riesgo de desarrollar la enfermedad. Gente que está en cuarentena también está siendo localizada a los moteles del área.
Y del otro albergue, donde creo que nada más son como 7 casos, ¿verdad? Ahí, ¿cómo está la situación? ¿Están monitoreando? ¿Qué están haciendo?
Sí, ahí estamos monitoreando para precisamente si es necesario movilizar a la gente a otros lugares. Lo más importante obviamente sería prevenir y que si estos 7 casos no se siguieran multiplicando. Thank you. Gracias, diría.
Xin chào quý vị, tôi là Khánh Ly, là nhân viên truyền thông của quận hạt Santa Clara. Kính thưa quý vị, ngày hôm nay quận hạt Santa Clara đã đưa ra một buổi họp báo để cập nhật cho quý vị những con số, những số người bị nhiễm bệnh COVID-19 trong những nơi tập trung đông người, ở các cơ sở chăm sóc dài hạn và những cơ sở dành cho những người vô gia cư. Như quý vị cũng biết thì từ tháng 11 chúng ta đã nhận thấy được những con số tăng cao, không kiểm soát được và tốc độ lây nhiễm cao trong cộng đồng, có nghĩa là chúng ta có nguy cơ cao bị nhiễm bệnh COVID-19 và đặc biệt là dành cho những cộng đồng dễ bị tổn thương thì cũng sẽ có nguy cơ cao hơn để bị nhiễm COVID-19. Các cơ sở chăm sóc dài hạn và những người vô gia cư ở trong những cái cơ sở dành cho những người vô gia cư và những khu và tập trung đông đúc người đã có một cái sự tăng mạnh về COVID-19. Ngay từ lúc mà đại dịch mới bắt đầu vào tháng 3 thì mục tiêu của các viên chức sở y tế là không chỉ là bảo vệ cho những người đang sinh sống ở trong cộng đồng mình, mà là bảo vệ cho những người dễ bị tổn thương nhất. Và vào sáng nay chúng tôi đã có được cái con số nhiễm bệnh của các cơ sở này. Chúng ta có 2 cơ sở lưu trú dành cho người vô gia cư thì số người nhiễm bệnh là 67 người và chúng ta cũng đang nhận được một cái sự bùng nổ COVID-19 trong 2 cơ sở chăm sóc dài hạn lớn. Một cơ sở là có 151 ca nhiễm COVID-19 và một cơ sở khác là có 86 ca nhiễm COVID-19. Kính thưa quý vị, con số này rất là đáng báo động và chúng tôi rất là lo lắng bởi vì sắp tới là dịp lễ Christmas, là dịp lễ lớn nhất trong năm và chúng ta không biết mình phải làm cách nào để có thể ngăn chặn được cái sự lây lan này. Thành ra là chúng tôi khẩn thiết kêu gọi quý vị hãy cùng chúng tôi cùng nhau đừng có đi ra ngoài nhiều, đừng có travel, đừng có đi những cái chuyến đi không cần thiết để chúng ta có thể ngăn chặn được cái sự lây lan trong khi là chúng ta đang chờ vaccine đến với mình. Thì kế hoạch phân bổ vaccine COVID-19 của quận hạt đã được nộp cho tiểu bang rồi và số lượng vaccine ban đầu sẽ cung cấp như thế nào đến cộng đồng là sẽ tuân theo các chính quyền tiểu bang và liên bang. Thành ra là trong cái thời gian mà mình đang chờ cái vaccine nó đến với mình á, là chúng tôi mong là quý vị hãy cùng chúng tôi ngăn chặn được cái sự lây lan này càng nhiều càng tốt, để vaccine đến thì mình có thể ngăn chặn được cái việc này luôn. Nếu như mà quý vị muốn biết thêm thông tin chi tiết về vaccine cũng như là những cái con số nhiễm bệnh đang tăng mạnh trong cộng đồng thì quý vị hãy vào cái trang mạng của Sở Y tế Công cộng. Chúng tôi có một cái đội ngũ để đưa cho quý vị đến những thông tin bằng 5 thứ tiếng khác nhau. Thì quý vị có thể vào trang mạng là www.scc.gov.org/coronavirus và quý vị hãy chọn tiếng Việt để có thể được đọc những thông tin bằng tiếng Việt. Xin cảm ơn.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.